Long as well. I know I didn't pass out a lot, but. So we got our fancy sphygmomanometer here.
Thank you.
Also called a blood pressure cuff. So you guys can follow along here. We're going to put this artery right at the brachial artery, okay? So the patient has big guns, you know, watch out. Gonna go to the gun show? There you go, that's good, right there. Fantastic. Okay guys, then you're going to get your 2 fingers and palpate right here. Now don't push too hard, you're just going to rest your fingers right here. Get 2 fingers and put it on the inside of the elbow. We're just resting our fingers there. On the inside, yeah. So you feel like a little lump, lump. And that's the pulse. It's a little heartbeat there. There you go. You can have your patients hold your meter if you want to.
Yeah.
Now you can hold it together. Usually you can just you can attach it, but oh well. So you can feel it right here. You can feel this little artery here. What we usually do is, if we don't want to squeeze someone's arm too hard, I usually just pump it up to 200 or 160. But technically the book wants you to squeeze it up and let it go slowly until you feel a pulse. And that's what's called your palp blood pressure. Then wherever you see the pulse, then you go 20 degrees higher, and then we start from there, descending to hear our blood pressure. It's okay, I'm going to go over this all again, but I'll just follow along if you're kind of lost. So you have a little pump right there. I saw you were like at 130, which is pretty good. So we're going to go about to 150 on our little meter here. So I found my pulse here, my AC pulse here. I'm going to put my stethoscope gently on this right here, okay? And guys, remember, turn your ears away from you so they can fit nice and snug in your ear. If it's the other way, it's going to point the other way. So just nice and gentle. It takes a little dexterity. So I'm going to pump up to about 150. Usually 160 is normal. So we slowly release.
Oh yeah. It's okay.
Ooh, so relax one more time. There you go. So once you hear that first lump, it's okay if you don't hear anything the first time. But once you hear that first lump, that's your systolic. That's the squeezing being pushed on the vessels of the heart, and some vessels of the body. And then the diastolic is when you don't hear that lump anymore, that and it goes silent. That's when your diastolic ends. That's the number. You can actually even see the actual the needle actually bounce. Yeah. You're a little high now, I think, because I pumped you twice. So if you pump your patient twice in a row, it's going to put a little more stress on the arm, and you might get a higher reading. Now, if your patient has like a really low blood pressure or a really high blood pressure, You're not going to run to the doctor and say, oh, it's high, oh my God. You know, or, oh, it's low. You do it on the other side. You do at least 2 or 3. I've taken up to 6 blood pressures on my patients from every extremity, from the arms, forearms, even the calves. Because it's like, man, my patient was like in the 150s, systolic for like 3 days. They were on 6 medications, dropping it. All of a sudden, right when I was going to give his 6 blood pressure medications, they were going to probably drop it. It hadn't dropped in the last 2 days. He all of a sudden went from 140s, 150s systolic down to like 120s, all in a matter of an hour. And there was no medication given. So that's why I did it over here, did it over here, did some on the forearm. I think I did about 6. And I ended up holding one of the medications. So just make sure you guys are reassessing. And if your blood pressure is like extremely low, do it on the other side. If that blood pressure is low too, you really just want to look at your patient. Patient fainting? Doesn't look like he's fainting. Yeah, there you go. Or does your patient look like they have like a what's called a hypertension crisis or high blood pressure? Is that normal for them? Or is he just stressed out because he's in front of the class? But usually your blood pressure should be normal. Normally, whatever's normal for you, 120 over 80 is pretty normal. If you work out a lot, or if you're in good health, or if you're small, then you'll probably be like in the 100s or 96 over 150s. So it really just depends. Cool. All right, guys. You guys get